Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes of OET and NCLEX. And as always, I teach OET and I just love it. And second thing, please subscribe our channel both for OET and NCLEX if you have not until now. And today we are discussing writing after a long time. Normally, we feel that writing is doing very fine and we don't need anything for letters. But yeah, I will try and cover this letter. This is a very old letter again. I have been teaching OET for such a long time. So this is a very old letter. So always start your letter from end, that to whom you are writing the letter. So if I read this letter, I can see write a referral letter to Mr. Johnny Ramon, Heidelberg Physiotherapy Center. So always notice the place and the person. So you're writing to Mr. John Ramone, Heidelberg Physiotherapy Center. So understand, Heidelberg is like, suppose if I say uh, Ilante Chandigarh. Suppose if I say anything, means it's the name of a place. In foreign countries, we have suburbs. So Heidelberg is the suburb. In every suburb in the foreign countries, you will have physiotherapy center, you will have community health center, you will have private clinics, you will have their own government setup. Like I was staying recently in UK. I was staying in at this Birmingham. Birmingham, one of the posh areas nearby was Edgbaston. So in that there was a big hospital of Edgbaston, and now the people come from different places. But Edgbaston has its own private clinic as well. They have their own physiotherapy center. So in foreign countries, whenever they make any suburb, they create any sector. Now even in India, when we create any sector, you have the local schools in that sector or nearby, because government reserves the site now according to the plan. Earlier it used to be, oh, school hamara bahut dur jaake hai. So but now, yeah, we have got schools nearby in private vicinities. So that is why, so you have to understand this place. There is always an importance of a place. So when you read OET, read it nicely, because you have got 45 minutes, so they will play with your energy. And the last date, which we normally say in OET, is the today's date. Last date is today's date. So this is the last date, 25th March 2009. So this is what we write as today's date. Physiotherapy assessment, improved balance. Now a person can get confused. Oh my God, physiotherapy assessment has already been done. He has got improved balance. Patient is walking outside. Reduced tightness in the hand, increase fitness and stamina, introduction of the keyboard, medication for sleep to be phased out. Now he does not, out means out. He does not need medications, that needs to be phased out with time. And so discharge plan means the plan is to conference with the speech therapist and OT and medical staff prior to discharge. So prior to discharge, they will have conference. Refer to community physio. Now, this is the point you need to understand. This is special. Now, even in today's letter, this is both a visit letter. This visit letter, no, but this is date is given. Normally, we believe that date means visit letter, but this letter is not a visit letter. Date means they are telling the progress on the day of the hospitalization. So, physiotherapy is good, uh, and this is good, and so now we have to refer the patient to community physio. So community physio means, that means, suppose this is what I want to teach you by the first line, that when you are going to Heidelberg, that means patient also lives in Heidelberg. If I live in Edgbaston, then I will go to Edgbaston Physiotherapy Center. So that is why it is known as community physio. That it is a community center, Heidelberg Physiotherapy Center, and you don't have to. The selection of data means you don't have to write this line, because we are right. This is the most important point I'm teaching you for OET. You are writing letter to the physiotherapist, so you have to write what he needs. He doesn't need this thing, conference with speech therapist prior to discharge. Community physio doesn't want to know about what will happen before the discharge. He wants to know what he needs to do. So he needs to provide physiotherapy weekly and then monthly treatment, and patient will live with his parents. With his parents, patient wishes to resume driving. So if I have to just write the purpose, suppose if I have to just write the purpose of the letter, then this is what you need to understand. Even if you are a doctor, you are a nurse, or even if you are a physiotherapist, this letter is for you all. And again, just follow the basics. So you don't have to go dig deep down in OET writing. You don't have to dig deep down. It's very simple. So you simply will say, okay, I'm just going to increase the font size. It's 14 at the moment. I will make it around 22. Yeah. So see, now what I have read, I'm writing to physiotherapy. Okay. So I will simply say, simple. This letter is being written regarding Mr. X or Mrs. X that I have not seen until now, who who needs physiotherapy on weekly basis, followed by means, otherwise it's a risky word. I normally say don't use it. But followed by means, first he needs the physiotherapy on weekly basis, followed by monthly appointments. Even you don't have to write this line, that physiotherapy can decide. Therefore, he is being referred under your expertise. This is how easy OET is. Letter can come difficult, your question can come difficult, but your answer, I'm afraid to say, or I'm glad to say, can never be difficult. This is your purpose. That's it. I'm writing to community physio. I just have to tell that he needs physiotherapy on weekly basis followed by monthly appointments. Then I can tell about other things. Mr. X. Now I will talk about social history and medical history. Now I will read the complete letter. Okay, the complete letter is patient to be discharged from the Heidelberg Rehabilitation Hospital today. So that means I am also part of rehabilitation hospital. I am a nurse over there. Following a work accident. Okay, he had a work accident. Means accident on the work. If even if I want to write this line as he wishes to resume driving, I can write this. But again, this will make it complex because now we have not talked about social history. We don't know he is a driver. So that is why I did not write. Otherwise, I can write as he wishes to resume driving. There is nothing wrong. But again, you want to be little logical. Otherwise, you should have started this letter is being written who then you have to write everything. Uh who had an accident at his work. After treatment, he is better. So then you write complete. If you want to write that way, this is our way. If you want, after treatment, he is better, but he needs ongoing. Ongoing means continue. That means he's already having physiotherapy. Now, this is our way of writing, the best way. This is little complicated, but can get you 350 easily. Like right now, I forgot the name, but this girl scored 410 in writing this time. This is our method. If you want to score more than 350, because in this, if you can see, you can understand everything about the patient. He had an accident at work, at his workplace. Now you know everything about worker. After treatment better, but he needs ongoing physiotherapy. Therefore he is being referred. Even if you don't write now this, but he needs ongoing physiotherapy. Therefore you are community physio. He is being referred under your expertise. So you can write it anyway. Your grammar should be fine. Your purpose should be clear. That is what it is all. Okay. So yeah, patient rehabilitation hospital, Ivan Miller, 1980, forklift driver. So he's forklift driver warehouse, live with the flatmate single. So that is what I would like to write. He's a forklift driver. Forklift driver at a warehouse. Because in this case, the letter is all about making him go back to work as he wants to resume driving. So I want to tell he's a fork. That is how you select data. You select data according to the letter. So there is no definite thing about OET. You have to select it. So Mr. Folk is a forklift driver at the warehouse. Okay, I got it. And was admitted to Royal Melbourne Hospital and was admitted to Royal Melbourne Hospital, complete hospital. Why? crushed under a forklift truck, had sustained due to accident where he got crushed under a forklift truck. And do you know, earlier we Indians were not very much known to what is forklift. If now you will see big warehouses, there are forklift that puts the boxes like this, goes up and put it on the shelf. So in the big metros, you see that kind of a truck where there is a fork like thing. It comes out, picks up, and drops the big boxes at the shelf. So that is what is a forklift. Okay, but again, we don't want. But again, we want to have the right images in our mind. R should be capital. Small things. This is punctuation. When you're writing a name of a hospital, it should be capital. R M H should be capital. So yeah, he was admitted to Royal Melbourne Hospital. Then what happened? Then there is no data that has been given. I can write on 18 January. Okay, and today we have written that is uh, on 18 January, and today is March 25th March. That means almost 2 months ago. 25th March is today, almost 2 months ago. So make images. 2 महीने पहले एक्सीडेंट हुआ था. There was an accident 2 months ago. That happened. So yeah, discharged to rehabilitation hospital. So later he was discharged to our. This is the way of writing. You write natural. You were discharged to our Heidelberg Rehabilitation Hospital. Even if by chance sometimes you feel H should be capital again, Heidelberg Rehabilitation, obviously you have to take care of the spellings in the final exams. I'm just telling you the method. So you just take, it's so natural where he got crushed. So after either there also we can see after they should have given something after being treated over there. This is better. After being treated over there, he was shifted to, he was discharged. Passive voice was plus third form. He passive voice was plus third form. He was discharged to overhead. Is there anything that has been given over here? Any treatment now? So on 20th February. So I would also say he was discharged to over Heidelberg Hospital on 20th February. So you can see he got treatment of 1 month in that hospital. If treatment would have been given, I would have mentioned something. But please write, if suppose a lot of treatment would have been given in the hospital, then you don't write everything, because now you just want to refer the patient for physio. You want to tell the physio he had an accident, and then he went to Royal Melbourne Hospital. After that, he was sent to us for rehabilitation. Okay, so what did we do? On 21st February, that means the following day. This is the best way of writing the next day, the following day. This is the best way of writing the next day or subsequent day. The following day is the best. But again, if you're following anything of my mind, like following, followed by, if you're 100% sure, then use it. Otherwise, simply say next. Don't change just because you're learning from me. Either you should know, followed by means the thing that is coming after. Thief is followed by the police. Thief is followed by the police. Thief is followed by the police. So that means thief is front, police is later. In the same way, this followed by monthly treatment, first weekly, weekly followed by monthly, monthly will be after, weekly will be first. Anyhow, patient will first get the weekly treatment, then will get monthly treatment. That is how things go. So you need to understand these small, today I'm teaching you writing after a long time, but I want to teach you everything about it. You have to take care of small things, but at the same time, you should not care too much, because now what the patient needs is only physiotherapy. That's it. So you don't have to over pressurize, but at the same time, you have to be careful. So on the following day, physiotherapy assessment was done. And now I don't want to talk to the physiotherapy about the memory difficulties, blood vision. Physiotherapy does not need it. So we want lost balance with ambient distraction, distracted by the auditory and visually. So he had lost balance with ambient distraction. So physiotherapist assessment, whatever the word has been given with a post of yes. Right, exactly that. Physiotherapist assessment was done. Again, just keep making passive voices. Was done. If you want to use better connectors in which he was found to have ambient distraction. What was the ambient distraction about? He was found to have lost loose balance. Loose balance on ambient distraction. What should I say? With ambient distraction. Again, don't over explain. So patient was not stable, basically. That is what they want to say. And we have to control the word count as well. So don't overwrite. Physical, ambulant, balance disturbance, right side weakness. So these are the main points I would like to write. Unable to weak, tightening of these are, even if I don't write this now, lose balance with distraction, then I don't have to worry. So now I'm mixing up and he had balance disturbances. Now I will make it simple. He had balance disturbances. Further, he was having XYZ, whatever you want to write from here, whatever he wants to write. Now it was different because plan was given. So now when you are confused, just simply write, therefore a plan was created to improve balance and ambulation. So for that, for that means for the problem. In the past, we say for that. In the present, we say for this. So now we are writing in the past. So we will write for that. For that means for these things because it's the past. Because we are talking about 21st. On 21st, he was having this condition. For that condition, a plan was created. Plan was created. Now this word would have saved you. Plan was created to improve balance and ambulation. You want to make it better? Passive voice, cut. Plan to improve balance and ambulation was created. Better. Flow. It's about how do you speak it. So now the flow is better. This is, you can do again, just write whatever is given. So you just simply say plan was created thing, upper extremity increase fitness. Then you talk about this uh, myofascial release and movement, whatever you want to cover. Again, you can't write everything because your word count will get too much. So you can understand from this. So this is the plan 21st, then you will say today. So now you will talk about the last visit, which is the most important visit. You want to write maximum thing is today. Today, now passive voice was plus third form. Now passive voice will convert into has been third form. Today he has been found to have what happened. So you will write all these things. Matlab, whatever you want to write. You can miss anything. You can talk about slow fine motor activity was slow. There was tightening. Therefore, was plan was created to those and myofascial release and movement of right arm function was done and all that thing you can write. If you can skip anything, you can write anything. But yeah, do talk about physical thing. Do talk about physical things. Increase fitness. Talk about it. Improve sleep patterns is not important for physio. But yeah, you can write it because ultimately when we sleep, we recover. So write only those things. Today, physiotherapy assessment has been done and he has been found to have improved balance. Patient can walk outside and has reduced tightness in hand. So now the plan has been created to increase fitness and stamina. Therefore, he is being referred under your expertise. Again, please understand. Physiotherapy assessment, I will write it here. Just OET doesn't what has been done to improve. So these are the only words I'm adding in this line. Has been done and he has been found to have improved balance and now patient can walk outside. He has, next line, he has, simply, next line. You don't have to try anything, he has. H capital, full stop के बाद, no connector is required, simply. He has reduced tightness in his hand. And now the plan is to simple, no complexion. And now the plan is to improve or increase fitness and stamina. Therefore, he is being referred under your expertise for weekly. Therefore, he is being referred under your expertise for weekly physiotherapy followed by. But again, physiotherapy is fine. Why to say followed by monthly visits? But you can also say followed by monthly appointments. If you want to write, there is no problem because ultimately physio will decide now what is required. So followed by monthly appointments. Please note now the extra point. Please note he wishes or the patient wishes to resume his driving. This is the main thing. Now I'm writing it in the form of please note. Should you require further information, feel free to contact yours sincerely. If the name is given, if your name is not given, then simply write yours faithfully. Okay, yours faithfully, and that's it. If your name is not given, then you say registered nurse, and this is all. So I hope it's visible to everyone. I'm just gonna ask you again, guys. Is it okay for you, everyone? I'm just gonna unmute you and will ask you, guys. Okay, understandable, comprehensive enough.
Yes, sir.
It's just
Yes, sir.
the marks are not deducted for what is not written. Marks are given for what is written. But yeah, talk about physical thing that this happened, that happened, that happened. Then the plan was created to increase stamina, this and this. Now is better and this and this. That's it. That's pretty much it. Okay, guys.